Hi, if you're delivering at Hinsdale Hospital, just give them our practice name and they'll take care of notifying us once your baby is born. We run every morning before office hours, so we'll see you bright and early. After your baby is born, they're given some APGAR scores to make sure that they've transitioned well into life out here. There's also some eye ointment that goes in their eyes and a shot of vitamin K to make sure they don't have any excessive bleeding. Once they're in the nursery, there is a newborn screen that's done when they're 24 hours old and a transcutaneous bilirubin level to make sure they're not getting too yellow. Also, a cardiac test is done, which is just a pulse ox to make sure their heart is functioning okay. Lactation consultants are there to help babies if they're nursing, and they're really helpful and we utilize them frequently. Babies are weighed every day and we expect babies to lose a little bit of weight in the first few days. So if your baby's weight is down each day, that's okay as long as it's within that 10% range. We see babies 48 hours after discharge, so if you're not delivering at Hinsdale Hospital, you'll see a hospitalist at the hospital, and then we'll still see you within 48 hours at our office at All Star Pediatrics.
After you leave the hospital with your newborn, we recommend you have a few items at home. We recommend a thermometer that measures across the forehead, under the arms, or rectally. We also recommend a humidifier or a nasal bulb suction like a nose Frida that helps clear the congestion from the nose. And finally, we recommend a resource book that can help answer your questions about any common developmental concerns or illnesses. Your first appointment in our office is going to be when your baby is 2 days out of the hospital, and then again when your baby is 3 weeks old. At these early visits, we'll monitor your baby's weight closely and make sure that they're eating well. Your first appointment for shots in our office is going to be when your baby's 2 months old. And then we'll see you frequently, every 2 to 3 months for these vaccines until your baby is a year and a half. We follow the American Academy of Pediatrics vaccine guidelines, and we feel that these immunizations are the most important thing to protect your baby early on against potentially deadly diseases. At each of your wellness visits, we'll start with a list of questions for you about your child or baby's daily activities and their developmental milestones. We ask you to come to your appointment with a list of questions for us as well. At selected appointments, we'll perform surveys to assess mental health or development. We'll perform in-office screening labs or a vision screener or a fluoride varnish. At the end of each appointment, we'll always give you anticipatory guidance, which is tips for the months ahead to prepare you for what comes next. As a small office with just 3 pediatricians, we pride ourselves on getting to know all of our families well and providing clear and unified advice and guidance for our families. For your wellness visits, you can ask to see whichever pediatrician you prefer or choose whichever time is best for you. For your sick visits, we ask that you see whoever's first available so that you have the shortest waiting time possible. Thank you.
Let's talk about the philosophy here at All Star Pediatrics. We strive to be a patient-centered medical home. And what does that mean? That means the patient is the center of our home, and we are here to support you and your family. You are the reason we are here. To be a medical home, we need to provide comprehensive care. And that means we're not just here when your child is sick, we are here when your child is also here for their routine wellness visits. And that means doing a lot of screenings for important things like mental health. We also want to be a comprehensive care in terms of coordination of care. Coordination of care meaning we are going to follow up. If we see that you went to the urgent care, we are going to follow up if you go to the ER. We want to make sure that you understood the instructions that were given to you and that you're getting good comprehensive care. We also strive to coordinate that you're making sure that you're following up with your labs. So we will call you to make sure that you're following up on your labs. If we refer you to a specialist, we want to have the complete record here. So we strive to follow up on wherever we sent you. If you choose to go to a specialist, we want to have all the record at one place. We also want to be fully accessible to you. We are here 24/7 for you and all of our patients. We are open from 8 to 4:30 Monday through Friday, and we're open 8 to 11:30 on Saturdays. When we are closed, you can still reach us. You can reach us by calling our on-call doctor at any time, and also you can reach us through the portal and send us a message for something that is not so urgent. During the day, nurses are available to answer all questions as well, and you can reach the doctors throughout the day as well. We are here for you. If something that you want to talk to us about, call us. We are very committed to quality here at All Star Pediatrics. We are all pediatric board certified. We make sure that we recertify and stay up to date with every change that happens in medical care. We are very judicious with our use of antibiotics. We are very pro-vaccine and very pro-breastfeeding, and will provide support where needed. Thank you for listening to this video, and we hope to see you soon. We love seeing our patients and growing with our patients.